In today's video, I'll be discussing with you 5 things why your vaginal infections keep coming back. If you are new to my channel, welcome. My name is Ifechukwu Prudensiana Okachukwu. I'm a registered nurse, a midwife, and a family planning provider. On my channel, I film health-related content, especially family planning and reproductive health. If this is the kind of content that you like, please give me a thumbs up and hit the subscribe button to join my YouTube family, and please don't forget to turn on your notification to notify you when I upload new videos. Keep watching. Have you ever wondered why your vaginal infections keep coming back? That you have treated yourself from infection and after like 1 week or 2, it will reoccur. Then this video is for you. Just sit and keep watching. So without wasting much of our time, let's dive into the topic. The first point is wrong diagnosis. For you to treat yourself of vaginal infection or any type of infection, you need to be sure of the exact infection that you are about to treat. Whenever you are feeling unwell or you feel that something is not going well right inside your body, you're having discharges or anything, please speak with your healthcare provider. Go to the hospital, speak with your doctor, speak with the pharmacist, speak with your nurse in the hospital, and be sure of what is wrong with you. Once you get the accurate and definite diagnosis of what is wrong with you, then it will work. But the moment you diagnose yourself, maybe from friends, they will tell you, no, it's this, it happened to me, this was what I used, do it this way. The moment you wrongly diagnose yourself, that is the beginning of your problem, because definitely the infection will reoccur. It will surely come back because you did not diagnose it very well. So whatever treatment that you will be taking will be wrong because diagnosis is wrong. Just like someone having typhoid and taking anti-malaria, that because you are having fever does not mean that every fever is caused by malaria. There are a lot of things that can cause fever. So you need to be sure of what is wrong with you, then to know what and how to go about it. So please, each time you feel unwell, speak with your doctor to get a definite diagnosis of your case. The second point is wrong medication. Some of us are guilty of this. I heard that a lot of women treat infection, treat for bacteria like every month, every 2 months, even without having any symptom at all. They see it as a normal thing that provided you're a woman, you should be treating infection every time. It's good. I've heard someone literally said this, and she was saying this, I think, at the bus stop, so I couldn't even talk. I couldn't talk. Like, I couldn't interfere in the discussion because they weren't talking to me, and the way her mouth was running, I could not literally like stop her or try to say something about it. So some of you treat yourself every month, every 2 months, or wherever. That as a woman, you're supposed to be treat yourself infections, supposed to take antibiotics from time to time. And the common one that they are abusing now is ampiclox. Yes, you know what I'm saying. Ampiclox. Self-medication is not good. Please stop self-medication. How are you even sure that the infection you are having is as a result of bacteria? Most of the vaginal infections are fungal infections. So you using antibiotics, you are just a kind of wasting your time. What the antibiotics will do is that because you are taking medication, you will feel as if the symptoms are reducing. It will just push the symptoms by the side until you are getting okay, you are fine. And the moment you stop the medication, highest 1 week, 2 weeks, the whole symptoms will just surface from nowhere. And you'll be telling yourself, this thing doesn't work. How? What's happened? This and that. I treated myself. Yes, you treated yourself, but you treated yourself wrongly. And even the antibiotics, even if it is a bacterium that is causing your infection, antibiotics has classes. Like we have bacteriostatic and bactericidal. Some antibiotics work by inhibiting they inhibit the growth of the bacteria. Some destroy the bacteria itself. So which one are you taking? Some are broad spectrum antibiotics. We have different types of antibiotics. This is not what I'm going to explain in this video. So which one exactly are you taking? You keep on taking antibiotics. Which one and how and why are you taking it? Self-medication is not good. So when you finish treating yourself, you go to the chemist, they will mix this one, put this one, you will start, you will take, you will rub, you will swallow. You are taking the wrong medications. Even after taking it for 2 weeks, 1 month, some of you will treat yourself for a long time, yet to no avail. Yet the problem is still there, but the symptoms just subsided because you are on medication. You end up producing, making yourself to be more vulnerable for drug resistance. I'm coming to that. The next point is that some of you don't complete your treatments. When a doctor prescribes medication for you, they will tell you, take this for 1 in the morning, 1 in the afternoon, 1 in the night, for 2 weeks or for 3 weeks or for 1 week. They'll tell you, take it. The doctor will explain to you how we are going to take the medication, maybe for 2 weeks or even 1 month, depending on the gravity or the severity of your infection. Fine. Now, some of you, after taking for like some days, you will notice that the symptoms has gone, like because you are taking the correct medication. Now, the symptoms will just disappear. It may even be within the first 3 days or 4 days. You will feel okay, you feel good. The next day, you start misusing the medication. You will take in the morning and you forget to take the afternoon dose. And even at night, you will take it even very close to the morning. And before 1 week, you will stop. But this is the medication that the doctor asks you to take for 2 weeks, 14 days. But you have ended up stopping the medication at 6 days. You are not completing it. Even though the symptoms have disappeared, inside, the drug needs to destroy the bacteria. What you are seeing or what you are feeling must have gone. But the inside, any little atom of the bacteria inside, if you stop with the medication, what you do is just to replicate, and the infection will come back again. So please, whenever a doctor asks you to take any medication, complete the course. If it is for 1 week, 2 weeks, 1 month, please try. Sometimes it doesn't feel good, like it's not easy to keep taking medication, but then try for your health. It's very, very important. The next is reinfection. Yes, especially for those who are sexually active. If you have a partner and you have vaginal infection, although some vaginal infections are not sexually transmitted, but some are sexually transmitted. So if the vaginal infection you have is sexually transmitted, and you will go as a woman or as a man, you treat yourself, cleanse yourself very well, and you are okay, then you still go back to your partner. What you are just trying to do is to reinfecting yourself. Definitely your treatment is not going to work again. Even though you have treated the whole bacteria, you have treated the infection, you have eradicated it, but you have gone back to the source of the infection. So what this means is that you are reinfecting yourself back. So the infection will keep coming. Medical experts always advise that if you have sexually transmitted infection or any infection and you have a sexual partner, please treat alongside with your partner. That is the best treatment. Encourage them, tell them the reason why they should go for tests and get themselves treated. Do not treat yourself alone, except you are not going back to the source of the infection. The last but not the least is drug resistance. This is a kind of link to what I said before, self-medication. When you are continually taking antibiotics, taking this, taking that, even when you don't have any symptoms or any reason to take antibiotics, when there is reason or when you have a reason to take antibiotics, when you go for a test called microscopic culture and sensitivity, MCS, what this means is that you'll be seeing R, and I. Sometimes the one that will be sensitive, which is S, some of you will see that R, I, and XX. What that R means is resistant, meaning that those drugs cannot do anything to that particular infection or bacteria or microorganism. It means that the body cannot work again. The body has a resistance. It's like it has created a barrier. It cannot work again because you have abused them. So you end up having the one like intermittent like it may stop the symptoms. Sometimes you will take it in combination with other antibiotics to help. And that is why some of us, when they have a serious infection, they will only have the option of taking a very strong and costly antibiotics. Example like Meronem. You find yourself taking only Meronem and that Meronem is very expensive. So stop self-medication so that when you are really sick, illness is inevitable. We are human beings. So that when there is need for you to take medication, there will be enough antibiotics or antifungal infection drugs that will be available for you to use. And that will go a long way to help you. If you found this video useful and you would like to join my YouTube family, please give me a thumbs up and please subscribe to my YouTube channel and turn on your notification to notify you when I drop new videos. Until I see you again in my next video, please do take care of yourself and drink plenty of water.